Hello there, everybody, and welcome to today's official OET live session with myself, Scott from Swoosh English. I hope you're all doing incredibly well. And once again, thanks a lot for coming along today to this session. So, as you may know, my name's Scott. I'm an OET teacher and academic director at Swoosh English. Who are we? Well, we're a premium preparation provider for the OET exam. We've helped thousands of students pass their OET exams before, and we would love for you to be next. So once again, thanks a lot for joining us today. Make sure that you say hello, guys. You'll see the chat box here or there or somewhere around your screen, depending on what you're watching on and also where you're watching, regardless if you're watching on Facebook or YouTube. So if you are, of course, are new to the session today and you want to get more OET content from Swoosh English and official OET, make sure that you like our Facebook page or subscribe to our YouTube channel. So let's just see who we have here today. I want to say hello to people before we begin. We have Simi has said hello. Hello to Simi. Hope you're doing very well. Alexi has said hi, Scoot. I like it when people call me Scoot, but my name is Scott. Hello, Alexi, and welcome back to today's session. Thanks a lot for joining us today. We have Sonia. Hello, Sonia. Welcome to the session today. We have Eliza says, good afternoon, sir. Good afternoon to you too, Eliza. Vanita says, hello, Scott. Hello to you too, Vanitha. Hello there to Christine as well. Hello to Eminea. Hello to Ansi. And hello to Manju. Oh, Ansi, I am very, very well. Chizo was joining saying, hello, Scott. How are you doing today? I'm not doing so bad. I have got a slight cold today, so I might cough. I might sneeze every so often. I apologize in advance. I'll try and turn off my microphone and my camera while that happens. But yeah, just one of those things to happen. So who do we have over on the OET YouTube feed? We have Inspire the Change says hi. We have Pragya. We have Venkat, Samuel. We have Raghav, Lois, Venkat again. Sorry, that might be the same Venkat. Might be a different one. Anil, Amira, Najiva, Jenna Lynn, Anu, Robin, Asma, Anu, Mehmet, Sarav, Admirer, and Sidashwar as well. Well done. Thanks a lot, guys, over in the YouTube feed. Make sure you're commenting and saying hello, and hello to everyone else over in that feed too. Let's see who we have on the OET Facebook feed. We have Selva, we have Jency, we have Bright, so bright, it must be said 2 times, amazing. Iniobon, one of our students, Anil, Shaza, we have Shanim, we have Jilani, we have Selva, we have Iona, we have Jackie, we have Mel, we have Junzi, we have Cheston, we have Solum Nuze, we have Sophie, Lynn, and one more, Seha, as well as Sarah as well. Welcome to everyone over there, and thanks a lot for checking in and also saying hello. You'll be using that chat box an awful lot today, guys, so make sure, of course, that you are commenting and interacting as much as possible to make this class a lot more enjoyable for everyone, not just me, but for everyone else too. Very good. Someone just said COVID alert because I've got the slight sneezes today. I'm pretty sure it's certain it's not that, but anyway, I enjoy your jokes. Welcome everyone to today's session. So everyone's from all over the world. I want to ask another question of everyone today. Where are you from, guys? Let me know in the comments where you are from today, please. I look forward to seeing where everyone is from. I'm from Ireland, where I currently am. I've lived all over the world myself, but I'm currently based back in Ireland. After all, it's very hard for anyone to really travel or move right now at the same time. But anyway, I'm pretty happy back here in Ireland. It's not a very nice day today. It's pretty grey. It's pretty windy. I'm sure the weather is nicer in other parts of the world too. So Anise has joined us saying, hello, Scott. I am from Zimbabwe. Thank you very much, Anise. Janice has said, I am from Malaysia. And Girth has joined us saying, I am from the Ukraine as well. Okay. We have Immaculate, who is also from Zimbabwe as well. Keep the comments coming in, guys. I want to know where everyone is from. Laz is from Sudan. Sophie's in the UK. Selva is from India, living in Tamil Nadu. Karen from the Philippines, Sarah from Kent, Elda from the UK, and Nana from Ghana as well. I like how that rhymed. Nana from Ghana. Very nice. Okay, who else do we have and where are they from? We got a good number of students here from Lagos, India, Philippines, India, Zimbabwe, Riyadh, Caroline, India, obviously a point of the world I've been to myself. I think is beautiful. Good number of Caroline students here today. We have Truly from Riyadh, Isaac from Pakistan, Truly from Riyadh as well, Anu from Qatar, etc. Very good, guys. Thanks a lot. Good, nice international bunch today, and thanks a lot for coming along today. A few more people have said. Eliza is from Nepal. Sonia is from Kerala. Mohammed is from Saudi Arabia. And Rebecca is currently checking in from Kerala as well. Thanks a lot, guys. Okay, introductions are done. You're here for a live OET skills class today, and that's exactly what I am going to deliver. So let's get started in our session today. Well, what is our session today? We're going to be looking at OET listening, essential skills for part B. Let's get into today's session. So exactly what will we be doing in today's OET essential skills cast, looking at skills for part B? Well, we're going to start off by doing a mini quiz on listening part B to test your knowledge. That is essential to know. You need to know the format of the exam. If you don't know it today, you will go away with a better idea about the format of the exam today. I'm going to analyze and practice some essential skills to assist you in scoring higher. 3 things that you should do every time that you do your OET listening part B practice, and then we'll do a mini mock exam with some feedback on the answer. So plenty of skills for you to take away today from this lesson. Now, of course, I want I want to let you all know right now that if you stay to the end of the class today, I'm going to tell you about how you can pass your OET exams with Swoosh English for even cheaper than usual, with a big discount code coming up at the very end of the class. So make sure you stay to the end to find out some more information about that. So the first question, I'd like to get to know everyone a bit more, not just your name, not just where you're from, but I want to learn what makes you tick, what makes you want to do this exam. What do you want to improve about your life? So the first question is, everyone in the chat box, let me know. I want to know, why are you taking the OET exam? What exactly are you doing all this for? Why are you doing all of this? Why do you want to go through the effort of passing this OET exam and trying to pass it? So let me know in the chat box, guys. What's your big reason? A few more people have joined us today. We have Jackie who said, hello, I'm from the Philippines. Adiola is from South Africa. And Simi is from Kuwait. Thank you very much. So I'm going to wait and see any more comments coming through. Why? Okay, we have May said, I want to work in the UK. And Gay says, I want to work abroad, right? So you want to work abroad, you want to work in the UK. Excellent. Afsal said to become a GP in the UK. Raghav said, I like it very much better than the IELTS exam. I'm not going to say anything. That's a funny comment. Esther has said to be able to work in the UK. To work in English-speaking countries, says Isaac. Michael, to work in the UK. Wish to work in the UK. Immigration, to travel, to migrate. These are all the big reasons that everyone is doing it for. Giath has said, for the GMC. Ednis, I want to relocate to Europe. Chizo, I want to write the OET, so I may relocate to the UK as an overseas nurse. Mohammed, I want to apply for jobs in Ireland or Australia. And Eliza, because I failed it before. Right, these are all great reasons, guys. You want to prove your life somehow. Either you want to move to a different country with a different lifestyle, or for a better salary, or for more skills, or for the enjoyment of travel. Keep that reason in your mind when you're going through the strenuous process of preparing for the OET exam. Always keep that in mind. Remember why you're doing it at the very, very end. That is very, very important. Okay. Now, can I ask, has anyone here taken the OET exam before? Are you new to OET preparation, or are you completely new to preparation? Let me know in the chat box. Tell me either I'm new. Also, tell me how many times you've taken the exam as well. I want to know, guys. There's no problem with that whatsoever. I want to know if you've taken the exam before, how many times. And if you haven't taken the exam before, then let me know that if you are new to preparation for this exam. In the meantime, Vanita has said, I would like to work any one of the European countries. Very nice. And Simi has said, OET is standardized English test based on my profession, and I would like to relocate to the UK. Okay. So a few people have said here. May has said, not yet. Gage has said, yes, I'm new to this. P Ping has said, I'm taking my exams and hope I can get some tips. Well, that's why you're here today, P Ping, I'm sure. Selva said first time. Mariama said 3 times. Okay. Darla said I am new to OET. Okay. Jackie is new. Mona has taken the exam once before. Okay. Good number of people saying I'm new. Lois is new. Rena has said new. Doreen has said new. New. Lygia said second time. Grace has said new. Critic has said not yet, etc., etc. There are lots of people. Okay. So Eliza has said first time in January. This is your taking time taking the exam. Muhammad has also said I took it once before too. So regardless if you are taking your exam for the first time or you've taken it the same time, or you've taken it before, maybe once, twice, etc., etc., I want to make sure that from today, excuse me, from today, no matter if from the listening class we're going to have today, I want you to take away a big piece of knowledge I have today, just some industry advice, and that is make sure that you are preparing adequately for this exam. You should treat your OET exam the exact same way, no matter how you approach it. You want to pass it the next time or the first time, not again and again and again and again. Okay. Thank you very much, guys, for that information. Now, I want to know, what is your biggest challenge with OET listening part B? You think about your OET listening exam. You might be new to preparation, as many of you are today. Maybe you're not too familiar with this part of the exam. Some of you know the exam quite well. That is completely fine. But I want to know, what's your biggest challenge with listening part B in your preparation that you're doing in your own time, in the videos that you've watched, in the classes that you've attended, in the activities and the exercise you have participated in? What's the biggest challenge that you guys have with OET listening part B? Throw it into the chat box, guys. No matter how big or how small, let me know exactly what that might be. So in the meantime, Chizo has said, I have not taken the OET before. Ednis has said, I'm taking it for the first time. I'm an amateur. Well, hopefully the first and the only time, Ednis. That's what I think. Okay. Chris has said, that's not an English word. Do you mean timing by that, Chris? Let me know, please. But also saying it's very tricky. I'm going to assume that you mean timing, but please let me know and clarify in the comments. Okay. So a few people are saying their exam is tomorrow. Asmed has said my exam is tomorrow as well. Okay, okay. Nisha is new to the OET. Shijina has said my answers are similar and confusing. It's similar and they are confusing as well. Kunjamal has said distractors. Mona has said all the answers look the same. Okay, so distractors is a comment I often hear. Betty has said, I'm stuck in 2 answers. There are 2 different answers which confuse me, and that affects my score. Couldn't find the exact answer, says Anu as well. Okay, and Mohammed has said, sometimes I couldn't decide which answer is correct. All of these are legit reasons. And you know what? In this class today, we're going to go through a few of these reasons that you have difficulty with OET and a few tips and techniques that you can use to improve your score in all of those. Are you ready for a quiz, guys? We're going to start off by knowing and just seeing exactly what you know about listening. We're not doing reading today. OET listening part B today. So let me know if you're ready for a quiz. Type into the chat box. We're going to do a quiz and see what you know about this exam. First question is, how long is listening part B, guys? Throw your comments into the chat box. How long is it in minutes, seconds, days? Imagine it was days long. And how long is it in minutes? Okay, in your OET listening part B. Okay, so in the meantime, Eliza said, I was more confident before, and this time for OET, even though I know maximum things about the OET. Yeah, your confidence can sometimes be shaken. That's very, very true. That's very, very true. But the important thing, Eliza, is that you keep moving forward with your preparation. Okay. Good. So question, guys, anyone can answer. How long is listening part B? Some people are saying 10 minutes. Some say you're paying 12 minutes, etc., etc. Approximately 9 minutes. 10 minutes, says Rowena. May has said 30 minutes. Kun Jamal has said 15 minutes. Jackie has said 45 minutes. Okay, we got a good number of comments coming in here. But the length of OET listening part B. Okay, okay. Different answers. Okay, guys, keep your answers in mind. Question number 2. How many recordings will you hear in listening part B? Let me know your comments, guys. How many recordings will you hear in listening part B? Throw your comments in, guys. Looking forward to seeing them. You can hear my voice today. It's slightly raspy from having my cold / COVID, some people might say. Chris has, Nana has said 6. Vanitha has said 6. Nana has said 6. Alexia says 6. Simi has said 6. And Teja has said 6, as well as everyone else said 6, 6, 6, 6, 6, 6, 6. Okay, we'll lock in 6 as an answer. Question number 3, guys. What will you hear in the recordings? What exactly will you hear? And please don't say you will hear someone speak. I will hear someone talk in English. Some people say those comments, and it makes me laugh every time. I hear someone speak in English. It's amazing. But let me know precisely what you will hear in the recordings, more detail. Who's speaking and to whom, and in what setting are they speaking in a little bit more. Oh, Mohammed, thank you very much. I'm getting a little bit better. I'm still here today talking to you guys and helping you pass your OET exams. Okay. So Chris has said conversation between two people, right? Yes. Okay. Any more detail on exactly what that is, guys? Thank you very much. Shajina said a monologue. Robin has said a conversation. Okay. A conversation is it could be the common word here. Pretty has said a conversation between patients and the medical professional. Okay. Right. Simi said health professional talkings. Okay. Let's lock those answers in. Question number 4. What type of task do you have to complete? Exactly. What is the type of task that you have to complete in listening part B? And don't say, I'll listen to an answer and I'll listen to a recording and I'll write down an answer. Please don't say that. If you do, I will laugh though. If you do actually say that, I will probably laugh. It is pretty funny at times. But I want to know exactly what it is. What type of task do you have to complete? Two-way conversation, says Ednice. And Mohammed says, Abu Zubair, says a conversation in a medical setup. Navina said regarding new rules and implementation. But what is the type of task? Eliza said a tick between 3 options. Okay, what's another word of saying that? Select the best answer. Other people are saying multiple choice questions. Right. I like that way of putting it though. Tick between 3 answers. That's a great way of describing it, Eliza. Okay, last question in our quiz. How many marks are there in total in listening part B? Let me know in the chat box, guys. How many marks are there in total for listening part B? Throw your comments in. Okay. Nana has also chimed in by saying multiple choice questions, and Mohammed has said, Mohammed has said a multiple choice question too. Right, Vanitha has said 6, and Simi has said 6, and Nana has said 6, as well as everyone else. Shajina, Barf, Nina, Priya, Semi, Tutan, Tisna, Conjamal, Arvin, Sunny, etc. Everyone is saying 6. Okay, well done. That is the quiz complete. Now, let's see exactly, and Eliza said 6 with a smiley face. It's very laughy people today. I like it when people laugh and enjoy themselves. Okay, let's see what your answers are to our listening part B quiz. Let's see how well you know this exam. So, well done. Listening part B is around 6 minutes in terms of the listening and answer time, but you will have slightly longer, of course, to write down your answers too. But in terms of the time to look at the question and listen to the recording, it's around 6+ minutes, but it's not strictly timed. How many recordings will you hear? You will have here 6 recordings, 6 different extracts. And what will you hear in the recordings? Yes, you will hear people speaking to other people in English. It's a great answer. But more precisely, you will hear workplace consultations. All of the recordings take place in a workplace setting between 2 professionals, or a professional and a patient, or maybe even more than 2 professionals talking about something that's happening in the workplace. What type of task do you have to complete? Ticking the answers, as some people say, but multiple choice questions, which pertain to 4 different types: gist, detail, purpose, and course of action. More about those 4 types very soon in this lesson. And how many marks are there in total? Well, there are 6 recordings, 6 different answers, so there are 6 marks for this section. Well done, guys. You know your listening part B quite well. So here is an example task for listening part B. Something like, you will hear a nurse reporting an incident to her manager. What should the nurse do first? And you have 3 different answer options. Let's analyze these very, very quickly. Well, the first section in the orange box is known as the context statement. It gives us an idea or a backdrop in terms of what's going to be happening in this context. A nurse talking to a manager about an incident, right? So we got an idea about the gist based on that, what's going to be talked about. Then we have what's known as the question. This can either be a direct question like this one, what should the nurse do first, question mark, and 3 different answer options, or it can also require completing a sentence where this option here, the question is a sentence half, and the 3 other options are a sentence half that completes it as well. Okay. Now, in terms of your time management, remember that you have 10 seconds approximately to read the question. It's not a lot of time because they happen quite rapidly with listening part B, but you should use those 10 seconds wisely to skim the question, to skim the answer options, take a note of your key words, the gist, the context, anything else that'll help you focusing in on answering the right question. And then you will simply listen and answer the question straight afterwards. Now, let's have a look at essential skill number 1. These 3 skills are going to be quite quick today because I want to give a good bit of time for a mock exam, but they're still very, very, very useful and can often be overlooked. Essential skill number 1 is reading all of the questions carefully before listening. Now, you might think, well, obviously reading the questions before listening. Of course, but believe it or not, some people don't do this. You're just so anxious and worked up to ready to go for the listening. I'm ready to listen that you forget to read and understand that this part is important for you to focus your listening in for what information you think that you may need. So in terms of what I mean by this, let's have a look at a sample question. So it says here, you will hear a pharmacist telling a patient about some medication. Why does she give a verbal explanation of the side effects? Now, you should be thinking of a few things here. Who is going to be speaking? Okay, so this might seem obvious, guys, but you should do this really, really quickly because it can help you focus in on what you have to listen here. So the first question is, who is going to be speaking, guys? Let me know in the chat box. Who is going to be speaking in this question? Okay. Pretty easy, but I want you to go through the process with me here. Who is going to be speaking? Okay. So the person who's going to be speaking is the pharmacist. So you know there's going to be a pharmacist speaking. Therefore, you know it's going to be a pharmacy style consultation. And that might help you out a bit more. The second thing you should think of is whom are they going to be speaking to? These are dialogues. So there will be 2 people speaking. So who are they going to be speaking to? Well, we can analyze. It's the patient, right? The pharmacist is going to be speaking to a patient, okay? Thirdly, how many people are likely to be involved in the interaction? Well, we know that we have a pharmacist and a patient and no one else is mentioned. So likely it's going to be 2 people speaking in this consultation. So we can focus in our listening going, a patient speaking to a pharmacist, and that's the 2 people I'm going to be listening to. There'll be no other surprises. The third thing we should ask is, what is the purpose of this interaction? What is going to be achieved from this interaction? And what might we have to listen out for overall? Well, let's have a look. So there's some medication being discussed here, okay? So maybe the pharmacist is talking about the patient about medication regarding something, but also what's the question going to say as well? The question says, why does she give a verbal explanation of the side effects, right? So we have a pharmacist talking to a patient about some medication, and they're going to be talking about side effects as well. So we can focus in our listening for exactly what's going to be happening here. This is so, so important because if you're not getting a good overall context or gist of the questions while you're listening, you're not going to know exactly what you're listening out for. So make sure you take a note of these 4 things in the 10 seconds really quickly. Underline who's speaking and to whom. What are they speaking about? And what is the purpose? Every single time when you're doing your analysis for these questions. Okay? That is essential skill number 1. Keep that in mind for when we're doing some practice. Who is speaking to who? How many people are speaking? And why are they speaking to each other? Underline those keywords every time. Okay? Essential skill number 2. We need to identify the listening skill of the exercises. Now, listening part B, each question will be slightly different depending on what we have to listen out for. These are known as the skills and they have a slightly different approach. Let's analyze these now a bit more. So, taking our question, what we mean by listening skills? Meta skills, so sub-skills of a skill. And it is your ability to recognize what sort of skills the exam questions are testing. We touched upon this a bit earlier. We're going to touch upon it a bit more now. Now, in listening part B, you will face OET listening questions, which test for 4 things. Gist, which is the main key or topic of the audio extract. What's the overall meaning? And there might be questions pertaining to the gist. What is the overall main point or main thing that's being conveyed between the two people? Subskill number 2, detail, which is something specific mentioned or said. So you're going to be looking at a short sentence or a part of a sentence which will give you your answer, depending on the question type. A course of action. So what is going to be done as mentioned in the audio extract. So something which suggests an action that is going to be done. And there are keywords that will obviously identify that based on the question. The final subskill is purpose, the reason for doing something. Now, these two can be quite similar. I understand that. But often a course of action will identify something that's going to happen, whereas a purpose is more of a reason for something occurring and something happening as well. So to do well in listening part B, we need to identify quickly from the question type as well as the answer type what the gist is. It a gist question, a detail question, a course of action question, or a purpose question that will be asked in listening part B. So let's just see now if we can maybe identify what kind of question is being asked just simply by looking at the question. Let's look at the question itself and try to identify what kind of question, what kind of answer type might this be? So let's read. It's the same question as last time. You hear a pharmacist telling a patient about some medication. Why does she give a verbal explanation of the side effects? So look at the language. Why does she give a verbal explanation of the side effects? Do you think this is a gist question, aka main key or topic, a detailed question, something specific mentioned, a course of action question, what is going to be done, or a purpose question, the reason for doing something? Throw your comments in, guys. I want to know what you think your idea is. And give me your reason for thinking as well about what this answer might be. So 4 different answer types. What do you think it might be by looking at the question, etc.? Let's see what we have here. Okay, let's wait for some comments to come in. There may be obviously a slight delay. That's fine, but I want to know what we think it is. So Anu has said purpose. Linda has said side effects of medication. Priya said to inform of the side effects. Okay, good, but which one do we think it is? Just detailed course of action or purpose? Anu has also said purpose here. Gage has said purpose. Afzal has said purpose. BN has said purpose. Kujamal has said purpose. Shaja has said purpose. Quite a lot of people here saying purpose. Vanitha purpose. Lois purpose. Nanice purpose. Edison purpose. I hope you're all right. I really do. Anyway, the good news is that it is a purpose question. Well done. It is the reason for doing something. And the keywords for that include here. Why does she give a verbal explanation? Why is the keyword. Why is something being taught? Often talking about a purpose. So you've been listening out for a reason that she gives her explanation about the side effects. Why is she talking about the side effects? Listening out for reasoning language. Well done. Let's look at a second example now. You hear a nurse handing over to a colleague at the end of her shift. What must the colleague be sure to do? So of course, it's important to look at your context statement here, but it's also important to read the question. What precisely is the questioning asking us to do? So once again, guys, looking, gist, detail, course of action, or purpose. Which type of meta question do we think this is based on our reading of the question? Throw your comments in again, guys. I'm looking forward to reading them. Okay, so Vanitha has said a course of action. Edson has said a course of action. Danice has said a course of action. Linda has said a purpose. Sharin has said purpose. Doreen has said purpose. Annabella said purpose. Grace has said purpose. Angelo has said course of action. Nisha has said course of action. Libby has said a course of action. Okay. And let's look over here as well on the Facebook feeds. Course of action, detail, course of action, course of action. Right. So this one is slightly more mixed. Teja said course of action. Alexi said course of action. And Chizo has said course of action. Michelle has said course of action too. Okay. Let's analyze why it is what it is. So this one isn't precisely clear by reading the question. So I've actually analyzed what could be two different answers here. One, of course, is a course of action. What is going to be done as mentioned in the audio extract? So what must the colleague be sure to do? So something that has to be done, we can analyze that as a course of action, right? So it involves something that's going to physically happen or be done. It could also be a detail because it could also be something very specific mentioned or said. So it could be a detail. Two reasons for doing so. Well done to those who create course of action. Sure to do would be our keyword here. Make sure you take note of that. Okay, something has to be done, more than likely a course of action, but it could also be a detail. Okay, last question type. Last example for essential skill number 2. You hear a physician giving feedback to a junior doctor after a consultation role play. He says the most important aspect of a good consultation is, I think that's a gist, detail, course of action, or purpose once again. Sanju has joined us saying, hello, Scott, and hello, Sanju. Welcome for joining us today. Thanks a lot for coming along. So giving feedback to a junior doctor after a consultation role play. He says the most important aspect of a good consultation is what? Vanitha has straight on to our answer saying detail. Very good. Tutana said a course of action. Tilja has said course of action. Kritik has said detail. Blessing has said course of action. Linda has said a course of action as well. Shajina has said a detail. Right, okay. Let's look in the Facebook feed. Shaza has said gist. Tawanda has said detail, and Diwala has said detail as well. Detail. So I think detail is the most common answer, but I'm seeing a few for gist, like Anu has said gist, Kritik has said gist, Marina has said gist, Nana has said gist as well. Okay. A good few more coming in too. Nana, gist, Danis, gist, and Chizo has said detail. Okay, let's analyze. We've got a mixed bag of answers right here. This one is a gist-based question, and I'm going to explain why. He says the most important aspect of a good consultation is. So the reason for that is because we're talking about the most important aspect of a good consultation. We know that it's a consultation role play happening. So it's the most important aspect of the role play. This more than likely will be the main key or topic of the audio extract because we use a superlative here, the most important aspect. Could be a detail, but more than likely it's being a gist because we know that from the context statement. We're talking about a consultation role play, and he's giving feedback to a junior doctor. Okay, guys, well done for analyzing our 4 types. We'll do a bit more practice with that in our mock role play session very soon. Our mock role play, our mock listening exam. Okay, essential skill number 3. Listen for ideas, not just for words. A common thing that often happens in the OET exam and any listening exam is that you're so transfixed when you hear a word that sounds like a word, which looks like a word in the audio, in the 3 answer options, that you just write down an answer. But you can't do that. OET will know if you're doing that and you will not get the right answer more than likely. I'm going to explain why. You need to listen for ideas and not just words here now in a second. Okay. So unlike section A, it's very possible, aka it's definitely going to happen, that none of the words from the multiple choice questions will be used in the actual recording. So you will have to listen carefully in order to make the correct selection. Part A, you hear the words, you put them in context. With this though, it's going to be a bit different. This is because in both sections B and C of the listening, you are being tested on your ability to listen for the message of the recording, the key detail, the idea, the gist, rather than just specific words. If you're listening for specific words, you more than likely will get the wrong answer. Now, there's 2 things to be aware of when listening for the overall message and ideas, not just words. And you've kind of touched on them already. One thing is paraphrasing. The words will be in a different form to how they are in the answer options in terms of collating them and matching them. And the second thing is the lovely distractors, which will be thrown your way, designed to trick people who are listening for words and not listening for ideas. Let's analyze a couple of examples here now. So we have once again our first question. It says up here, you hear a pharmacist telling a patient about some medication. Why does she give a verbal explanation of the side effects? And now we have our 3 answers. To highlight their severity, to ensure the patient understands, and to allow the patient to raise any concerns. Here is the audio script, which has the correct answer in it. So let's practice our reading skills now. I'm going to tell you about synonyms in a second. But read the three answer options here. Read the audio script. And I'll give you a little bit of time to tell me what you think the right answer is based on your reading of this section here. So I'll give you all a small amount of time to read the three answer options, read the audio script, extract, and see if you can get the right answer based on this. Give you all a bit of time, and I'll be back in a second. Make sure you put your answers in the chat box, guys. Okay, we got a few different answers coming in here. A lot of people are going between B and between C. Some people are even saying A as well, okay? So let's have a look now at the three answer options based on our reading of this extract, okay? The answer to this one is C, and I'll explain why now. To allow the patient to raise any concerns. We'll see at the very end here, based on the paraphrasing right here. I must answer any queries you may have before you're discharged. But remember, you should contact your doctor or the ward immediately if you have any concerns. So the wording isn't the exact same. Raise any concerns changes into you have any concerns. Raise any concerns, make sure I answer any queries you may have before your discharge. So we have an example of paraphrasing here. The words completely change or the word order changed. Now, some people have said A and some people have said B. Now, is there anything in this that highlights their severity? Is there anything in this audio extract that suggests that the side effects of atorvastatin medication is serious? No, there's nothing in this to say how serious they are. That eliminates A. But also, some people have said to ensure the patient understands. Now, you might think that is the answer, but there's actually one line here which suggests that she is not giving a verbal explanation, aka this is the reason why she's explaining the side effects. She says here, this is all explained in the booklet I'll give you. So that's not being explained by her verbally. That's being explained in the booklet that she's giving her. Here's a distractor right here, okay? And the reason why is I want to make sure any queries you may have before your discharge are understood. And if you have any concerns, please raise them to me so you can contact your doctor or your ward. And that is the reason why it is C. As we can see, some paraphrasing has been used here. Okay, we have a second example now. It says, you hear a nurse handing over to a colleague at the end of her shift. What must the colleague be sure to do? Order a mobile chest x-ray, monitor the patient's vital signs, check for a positive blood culture. Once again, guys, what do you think the answer is? Read your three answer options. Make sure you do the question in detail, the three answer options, and have a read through the audio extract here. What do you think the answer is? Simply reading this. I'll give you all a bit of time and be back in a moment. Make sure you throw your comments into the chat box. Good luck. Okay, we have some answers coming in here. Mohammed has said B, Suchita has said B, Alexi has said B, and Vinitha has said B, as well as Kate Lee has joined us today saying B as well. As a lot of other people in other feeds, B, 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 a couple of C's as well, but most people are answering B for this one. Okay, let's analyze what the answer was. I hope you're all right. The good news is that you are all right. B is the correct one. This is a classic example of distractors, but you weren't distracted here because I think you've been aware that you have to read around for ideas. Yes, when you're listening, it's a bit different, but I want to show you what it looks like in the audio script a bit better. Now, the reason for it, monitoring the patient's vital signs, is because it says here, you'll need to check that his vitals are stable and unchanged for now. What must the colleague be sure to do? A course of action question. You'll need to check. So keywords, you'll need to. Something that must be done. Check that his vitals are stable and unchanged for now. Monitor the patient's vital signs. Now, were there any distractors in this one? There were. There was a distractor option for A and for C. If you're listening just simply for words, you might have put down this answer. Let's analyze why these were incorrect. So A, order a mobile chest x-ray. Okay. It says here, Dr. Stone needs to determine if his blood culture is positive. And if his respiratory status worsens, he'll most likely get you to order a mobile chest x-ray to check for an effusion. So yeah, both of these have been mentioned. Blood culture is mentioned here, answer option C, and chest x-ray has been mentioned here, answer option A. But why is it not the right answer? Well, the question asks, what must the colleague be sure to do? The colleague. But this is talking about Dr. Stone, not the colleague. They will need to do this instead. So a distractor option, listening out for who's speaking and to whom, what exactly and who needs to do what. If you heard Dr. Stone, you would know, oh yeah, well, Dr. Stone isn't a colleague, so all of this does not apply to him, but this does. You'll need to check that his vitals are stable and unchanged for now. So here we can see an example of some distractors. Be aware about who is speaking to who and what do they have to do as based on the question here. Listen out for all of these things really carefully. These distractors are designed to catch you out if you're listening just simply to words rather than messages, ideas, who's speaking, and the purpose of it overall. So please keep that in mind, guys, when you're doing your listening part B practice. Okay. Let's quickly review the skills we practiced today. Remember to learn the format of the exam section. Use your 10 seconds wisely to analyze the question and answer option keywords. The answer could pertain to gist, detail, purpose, and course of action. Try and identify those in the 10 seconds or make sure you're practicing enough to identify that in your OET preparation leading up to your exam. Remember, the audio will make use of synonyms and other paraphrasing devices. It won't be the exact same as read in the answer options. Be aware of distractors like we had there. Some of you were caught out in the first one, but you did much better in the second one, being aware of those distractors. And of course, practice makes perfect. Make sure you're doing lots and lots of practice in your own time. You want to make sure that you're ready to take your exam and pass it the first time and not taking it again and again and again and again. And that's where expert help and feedback does come in to ensure you're ready to take the exam and pass it the first time. Okay, let's put all this into practice by doing a mini mock exam. Let me know if you're ready to do a mini mock exam today. We're going to practice some listening part B live in this class. So throw in your comments. Let me know if you're ready. If you're not ready, say no. It doesn't matter. I'm going to do the mini mock exam anyway, regardless of you're ready. So you might as well say that you are ready in this overall. Once I got 3 comments, I'm going to resume with this mini mock exam. I'm only joking. Let's go ahead with it. Guys, if you're enjoying this class today, make sure you give us a like on Facebook and YouTube. Send us a comment. Let me know if you're appreciating this class today. And if you're not following us at Swoosh English, make sure you follow us on Facebook or click the subscribe button on the YouTube channel to be up to date with all of our new videos as they are released. Good. Everyone is ready. Let's get started. So before we begin, I want to remind everyone that for coming along today, I'm offering 20% off an OET Swoosh English preparation course. It's valid only for the first 15 signups, and it's only valid until Sunday midnight UK time, so you don't have a lot of time to do so. But now is the best time for you to get up the top of a Swoosh English preparation course if you're looking for more expert tips and tricks on how to pass your OET exam first time with expert native English speaking UK teachers and a trusted and tested program. If you're interested in that, guys, all you need is a discount code, OET Live 20 off. You will enter your discount code OET Live 20 off at swooshedenglish.com and you'll get access to a 20% discount on our OET online preparation packages at Swoosh English. So take a note of that code, OET Live 20 off. I'll be talking more about it later on, but make sure you make use of that in time for your OET preparation. Okay, guys, here is answer number one, or question number one, sorry. You hear a dentist talking to a patient about implant surgery. What has the patient misunderstood about the proposed treatment? Here are the three answer options, 10 seconds to read, and then we play the recording.
So, that's all done. Was there anything you wanted to ask me?
Yeah, I've still got this big gap on the other side. I remember you said we might do an implant there too, but that it'd mean a slightly different procedure. If I remember correctly, you said that you couldn't put one there because of the bone, but that you could connect it to the tooth next door. Is that right?
Well, partly. What we discussed was what we'd do if you lost the next tooth along. So we'd have to extract that one.
Right.
Then you'd probably need a bone graft there so that we could attach two teeth to a new implant. The gap you're talking about is where you've lost a big molar.
Right.
We couldn't fill that gap completely using this technique because that'd put too much pressure on the implant.
I see. Well, you said the price would be much higher than the one I've just had done. I guess that's why.
Uh-huh.
Okay, guys, so what do you think the answer was? Let's analyze and see what the answer was in that one. So throw in your comments, guys, what you think the answer was. Good people are saying B, 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 B. Okay, well done to those who are saying B. The answer was the extent of the surgery required, that is analyzed here. What has the patient misunderstood? Key word about the proposed treatment. The extent of the surgery required. And this all explains it. Yeah, I've still got this big gap on the other side. I remember you said we might do an implant there too. That means I'm a slightly different procedures. Understanding misunderstood here. If I remember correctly, you said that you couldn't put one there because of the bone, but that you could connect to the tooth next door. Is that right? They've misunderstood a lot about this procedure, and that is why it wasn't answered here in this context. Second example, you hear a surgeon conducting a debriefing meeting with his team. What problem are they going to follow up immediately? Procedures not running on schedule, equipment not being readily available, paperwork not being dealt with efficiently. So remember, look at the question. Who's speaking to whom? What are they speaking about? What type of question do you think it is? And focus in your listening on that. Good luck. Let's play the second recording.
Okay, we need to do our debriefing. Any comments about the case, Jackie?
Well, we were late getting started due to a delay in getting the surgical consent to come in, but I've talked to the junior resident and I think we just had a few crossed wires there, so it's sorted.
Yeah, we were busy in clinic this morning, but we were also delayed getting into this room because the case before us went over their time, which pushed us back. That's becoming a regular occurrence with that particular team. I'm going to ask our nurse manager to adjust their time slots based on the recent history of their cases.
We were also slow to get the portable films from radiology. There were several rooms requesting films, and radiology seemed short-staffed. That's unusual for them, but let's keep an eye on that, and if it happens again, raise it as a concern.
Once again, guys, what do you think the answer was? Throw it in. Was it A, was it B, or was it C? Looking forward to seeing your answers, guys. So we got A. Most people are saying A so far. A few people are saying B. A. Okay, let's analyze and see what it was. So the answer to this one was A. What problem are they going to follow up immediately? Procedures not running to schedule. So a follow-up would suggest a course of action. What language in this indicates something that's going to happen immediately? And it says all the way here, we are getting late started and a delay in getting surgical consent to come in. But I've talked to the junior resident and I think we just crossed a few wires here. So it's sorted. We were busy in the clinic this morning, but we were also delayed getting back into the room, which pushed us back. That's becoming a regular occurrence for the particular team. I'm going to ask our nurse manager to adjust their time slots based on the recent history of the cases. Okay. An action is going to happen here. They're going to ask the manager to stop all of this stuff from not running to schedule. And that is why that answer was what it was. And I'm sure for those who got A correct, that's why you thought it was that answer too. Well done. Okay, extract 3. You hear a nurse handing over to a colleague at the end of her shift. What does the incoming nurse need to do for the patient? A, contact the doctor about his pain management, arrange for him to be taken for physiotherapy. B, and C, set up some monitoring of his mental acuity. So once again, who's speaking to who, what kind of question it is, what skill are we listening out for, gist, purpose, course of action, or detail. Let's play the third recording, sorry.
In bed 12, we have Liam Ogilvie. Liam's a 45-year-old male who was involved in a motorbike accident and was admitted with a frontal lobe contusion. He's broken his right arm and hand and has had surgery, including metal plates inserted into his arm.
Right.
He's also got deep grazes on his left knee and ankle and stitches on his right leg and shoulder. All dressings have been changed this morning at 9 and he's on self-administered morphine drip as well as an antibiotic drip. He's had injections to prevent blood clotting and his pain's quite manageable with the medication he's on. The doctor's requested some observation and testing regarding memory loss, so that's priority this morning. His right arm's in a cast and he'll need regular monitoring and a physiotherapy sessions booked later in the afternoon. Somebody's coming to collect him at 4. I've just checked his vital signs and he's stable with blood pressure at 135/95. It's a bit up, so you'll need to watch that.
Okay, guys, let's analyze. What do we think the answer was for extract number 3? Throw your answer in. Was it A, was it B, or even was it C? Let me know in the comments, guys. Vanitha has said C. Mohammed has said C. Anu has said C. Manju has said C. Pragya has said C. Okay, a lot of people are saying C here over in the Facebook feed. Gage C. Lynn C. Kujmal C. Let's see what the answer was. It was C. Well done to those who all got that correct. We have reached a consensus here. Set up some monitoring of his mental acuity. And it's mentioned just here. The doctor's requested some observation and testing regarding memory loss. So that's the priority this morning. Priority, it needs to be done regarding his memory loss. So precise language and ideas here. Well done to those who got it correct. Extract number 4. You hear a doctor briefing a group of student nurses about taking blood. What is the doctor doing? What are they doing? Reminding them about a psychological cause of a misleading reading, warning them to check more carefully that the cuff is the right size. C, explain to them exactly what they should, how they should seat the patient. So what is the doctor doing? What indicates something that a doctor is doing might give you a clue to the type of question that's being asked here. Once again, guys, turn off my camera. We'll play the recording. Good luck.
Okay, now some feedback on how you've been taking blood pressure on the ward today. Before you report a reading that seems outside the normal range, check that the cuff you're using isn't too small, as this can push up the reading. I'm pleased it's not been an issue for you, judging by what I've observed. However, the patient must be in a position that's comfortable. and sometimes you're not quite managing that. To be more precise, please ensure in future that both the back and arm are supported, with the upper arm at the same level as the heart. You all seem to have taken on board that quite a few patients will be nervous when they're with medical staff, and this may result in significantly higher blood pressure. So it was good to see you weren't too alarmed by some of the higher readings today.
Okay, guys, once again, throw in your answer. Do we think it was A? Do we think it was B? Or do we think it was C? Looking forward to seeing your comments here, guys. A, B, or C? Okay, some people here are saying C, 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 C. Okay, the consensus seems to be C for this one. I hope that you're all right. The answer was C. What is the doctor doing? Well done. Explain to them exactly how they should seat the patient. There's lots of language here talking about how the doctor should seat the patient. The patient must be in a position that's comfortable, and sometimes you're not quite managing that. That's what they need to do. To be more precise, please ensure in future that both and the back and the arm are supported with an upper arm at the same level as the heart. So this is what the doctor is doing, explaining to them exactly how they should seat the patient. It's mentioned throughout in this one. Well done to those who got that one correct. Extract number 5. We've got 2 more to go. You hear 2 nurses on an orthopedic ward doing a handover at the change of a shift. What does the nurse want his colleague to do first? This might be an important word to look at. It will suggest order. There might be a list of things that need to be done, but what needs to be done first? And the 3 answer options. Good luck, guys. I'm going to play the recording now. Take a brief moment and look at the questions.
Now, Mr. Mitchell in bed 17 has had a hip replacement and has been assessed as being at high risk of developing deep vein thrombosis. The fitting of the compression stocking today was fine initially, though later he complained about it being slightly uncomfortable to wear.
Okay, not much we can do about that, I guess. What anticoagulant medication is he on?
It's written down here. He's just had his latest dose, so requires nothing more until 11 o'clock. I'd go and have a chat straight away about how vital it is for him to walk around, or at least flex his muscles every half hour or so.
Okay, I was told yesterday he can be reluctant to get moving.
Well, I'm sure he can be persuaded. He is taking plenty of fluids though, but please continue to monitor his intake during your shift. Thanks.
Okay, guys, once again, what do we think the answer was? A, B, or C? Throw your comments in. JB has said B so far. Okay, let's see who else we have. Sidishwar has said B. Dahlia has said B. Excellent, keep on coming. Nancy has said A. Namisha has said B. Preetha has said B. Suchita A. Esteja B. A. Okay, we got a mix of answers here. Let's analyze and see exactly what it was. So for this one, the answer, believe it or not, was A. Oh, what's happened to my record and my PowerPoint here? Doesn't matter, we can see the answer options here. Okay, so explain to the patient the need for regular exercise. Keyword first. It says here, it's written down here, he just had his latest dose, requires nothing more until 11 o'clock. I'd go and have a chat straight away. Okay, the first thing to do right now, straight away, about how vital it is for him to walk around or at least flex his muscles every half an hour or so. And the key word here is straight away, indicating what needs to be done first. To those that got that one right, well done. Last answer, last extract we have is extract 6. You hear a nurse talking to a patient who's being discharged from hospital with his arm in a plaster cast. What is she doing? What kind of question do you think this might be? Just detail, course of action, or purpose. And our 3 answer options here as well. Take a moment, read through them, identify who's speaking to whom, what the context is, and what you have to listen out for.
So, Mr. Clark, you'll need to keep the cast dry, which means covering it with a plastic bag when taking a shower. I'm sure you'll manage.
If the cast does get wet, I can use a hairdryer, can't I?
Yes, put it on a cool setting, though. One other thing, it's easy to forget to exercise the shoulder and the elbow. Don't sit all day like a statue.
Right. And it's not normal to feel any tingling or numbness.
It's unlikely to happen, but inform us as soon as possible if it does. After a day or two, some people can start to feel the cast is too tight or too loose. Again, if that's an issue, you should let us know.
Okay, so you can adjust it?
Actually, we can replace the cast if there's any discomfort.
Ah.
And that's the last extract of our mini mock exam today, guys. Well done. Okay, let's see what we think the answer was. A, B, or C. Throw your answers in one more time, guys. A, B, or C. Okay, Alhanza has said B. Good, keep it coming, guys. Alhanza has said B. Gigi Francis has said A. Anila has said C. Okay, we got a mixture of answer options coming through already, but that's always going to be the case. That is fine, okay? Anu Rathesh says C. Rima says C. Sinia says C. Ifunanya has said C. Okay, we have C coming through. A good number of answer options coming in here. Okay, let's analyze and see what this might be. Okay, the answer to this one was C. What is she doing? Explaining when it would be necessary to contact the hospital. Let's analyze that now and see why that was the answer. Well, it says here, it's unlikely to happen, but inform us as soon as possible if it does. After a day or two, some people can start to feel the cast is too tight or too loose. Again, if that's an issue, you should let us know, aka when to contact the hospital about something that's happening with his plaster cast, okay? She doesn't really mention any kind of exercise that has to be done. She said it's easy to forget exercise, but not what should be done, what type of exercise. And she doesn't really mention the practical difficulties in keeping the cast dry. She just says you can keep it dry, but nothing about practical difficulties, therefore making C the best answer option. Well done, guys. So who can tell me how many answers did you get correct in the mock exam today? Did you get 6 out of 6, 5 out of 6, etc., etc.? Throw your answers in, guys. I want to know how you got on today in practicing those 3 skills in some mock exam situation. I want to know how you got on today. Some good answers coming in today. Anything a 4 or above is a very, very good score and should be very, very respectable and enjoyed. And I can see a lot of people are doing pretty well with that so far. Keep them coming in, guys. Saeed got 6 out of 6. Nice work, Saeed. Kate Lee got 5 out of 6. Alexi got 5 out of 6. Denise got 4. Lois got 4. Sachita got 4. And Benitha got 5. Nice answers. We've got mostly 4 or above. A lot of 5s and a good number of 6s coming in too. Well done, guys. Nice work on practicing all of that today. Mohammed said, I got 6 out of 6, but I'm not sure how I did that. You did it by practicing the skills today. So well done, guys. Remember, review the skills of today's session. Learn the format of the exam. Use your 10 seconds wisely. Identify the question type, your gist, your detail, your purpose, your course of action. Make use of synonyms, be aware of them, and be aware of distractors. But the last one is really really important. Practice makes perfect. You won't ace the OET exam in one day or doing one activity. It takes consistent practice over time with feedback and great quality materials. But well done. So guys, I want to remind everyone about our special offer today. Anyone who's come to this class, you now have an opportunity to get 20% off your Swoosh English OET courses. That's 20% off our preparation course, where you'll get access to more mock exams like that, more listening and reading classes, and feedback on your speaking and writing. If you're interested in that, here is our discount code, OET Live 20 off. All you have to do is enter our discount code, OET Live 20 off, at applicable packages on the Swoosh English website, and you will get 20% off your preparation course here at Swoosh English. Well done. So, guys, in terms of how you can use that, well, it's only for the first 15 only, and it's only applicable for another few days. So make sure you jump on that really, really quickly. Now, I want to know, does anyone here have their exam within 1 month? Who has their exam, your OET exam, in 1 month? Let me know in the chat box, guys, if you have an upcoming exam and is that exam within 1 month. Say me, or yes, or I am, or that's me in the chat box, guys. I want to know. This question is for you. Okay, that question is for you. Who has their exam coming up within 1 month? So Denise has said me. Denise, sorry, has said me. A few other people are saying me. Okay, me. Yes, some people are coming up within 1 month. Right, that's very, very important to remember. Tomorrow says some people, yes, me. Okay, yes, people are saying me. That's very important. So I want to be aware that this is really, really important for you to make sure that next month you are doing all that you can to pass your OET exam. There's not a lot of time. I want to make sure you've been applying and studying effectively in that time, but now it's crunch time to ensure you're ready to pass that exam with 1 month. And because of that, we recommend our intensive package for you. Our intensive package has been designed for someone who needs a short-term crash course in passing their OET exam the first time. And that's why our intensive package is ideal. I'm just going to share my screen and show you our intensive package. Now. So guys, you'll see the screen here. It's our OET intensive package. For $149, for doctors and nurses, you get a short-term crash course and you get access to all of the following. Our self-study video courses and all skills and subtests. You'll get access to an OET exam readiness test, so you can take the OET exam before you've even taken it and learn how to pass it. A letter model answer bank with some previously corrected letters. 8 sets of listening and reading mock exams with post-analysis mock exam feedback. So you'll get access to more mock exams like we just did today. More chance for you to practice with feedback, your OET listening part B and others. You will get access to 15 of your OET letters corrected with expert feedback from our expert OET teachers. You can do that 7 days a week, making it flexible around your work and your other studies. Last but not least, you'll get access to all of our group classes, of which there are over 14 hours per week, including our writing corrections classes, our live group classes in all skills, and our speaking mock exam live group classes, all taught by expert teachers, all happen live 2 times a day. And if you can't attend the class for whatever reason, you can watch the live class recording at a later date. It doesn't end there. You get access to our Facebook feed support group where you get 24/7 support from our team of teachers and our alumni students. And you get access to our Zoom study room speaking sessions where you can take your study buddy and go into a session and practice speaking and studying together via our platform. So there's a lot of stuff you can access there for both doctors and nurses, as well as any other profession as well. We can make that course for you for just $149. But the best thing is that with a 20% code, you will get that for 20% off. So what's 20% of $149? You'll get it for $119 today. Only $119 versus $149. So make sure that you take that discount code, check the links on the left-hand side in the Swoosh, in the Facebook chat box, the YouTube chat box, and apply that discount to an intensive course. Recommendable if you only have a short amount of time for your OET exam. Now it's the crunch time. Now it's time for you to make sure you're ready to pass, and you need feedback, mock exams, and other materials in order to do so. Okay, guys. Second question before we finish is, has anyone not booked their OET exam? Let me know in the chat box, guys. Have you not booked your OET exam yet? Let me know in the chat box if it's completely new to you. Because the good thing is, if you've not booked your exam yet, don't book it just yet. Think about preparing for your exam first before you book your exam. Give yourself more time than you might think to prepare and pass this exam, because a lot of people don't pass the exam the first time. The reason for that is because they don't prepare enough. They book the exam within a week, 2 weeks to a month, or they don't prepare adequately and they're taking the exam again and again and again and again. So let me know, guys, who here has their exam, hasn't booked their exam yet. Okay, good few people are saying right now, haven't booked it yet, haven't booked it yet, haven't booked it yet. That's completely fine. Don't book it yet. Please go through the mindset of thinking about how you pass your exam first before you take it. Make sure you're ready in advance before you book it, okay? We have an answer option for everyone else in that, and that is our deluxe course. Our deluxe course is designed for someone who needs extra preparation time for their OET exam, but can take up to a year to prepare for their exam. And that's why I recommend our deluxe option for you. I'm just going to share our deluxe course right here, right now, and tell you a bit more about that. So it's similar in its content, but you have access to this course for 12 months, and you get access to all the same sort of material, slightly less because it's not intensive, our video course, our exam readiness test, our reading and mock exams, 10 writing corrections, 7 days a week, and access to all of our live classes as well. Many students take this course and pass their exam the first time, and we'd love for you to make the most of this course offering too. All for just $189, but with 20% off, you'll get access to that course for approximately $140. That's only $140. So much cheaper than even taking the exam one time only. So you'll see the link, guys, in the chat box to our deluxe package. You'll get 20% off if you use discount code OET20 off today in your OET preparation for that. But the most important thing, guys, is today is that you've learned how to pass the exam. You learned some OET listening part B skills today. It's now over to you to continue that journey and prepare for your exam. Many students pass the exam after their 4th attempt, and that's $1,500, etc., wasted in OET exam fees. I don't want you to be that person. Rather, I think it's best for you to invest in a high quality preparation course with expert teachers who know what they're doing to help you pass the first time. You will save money and you will save time. And that's why our intensive course for someone who has less than a month preparation and our deluxe course for someone who has all the time they need to prepare for their exam is the best advice for you. So to get 20% off any of those courses today, use this discount code OET Live 20 off for 20% off selected courses, including our intensive course and our deluxe course today. But remember that it's only for the first 15 who sign up, and it's only valid for a few days until Sunday midnight UK time. So guys, please make the most of that. I don't want you coming back and taking the exam again and again and again. Why not join us at Swoosh English today and pass for even cheaper than you normally would? So guys, thanks a lot for coming along to the class today. I really, really hope that you enjoyed that session today. It was great teaching you all about some listening part B practice. Go away, apply the lessons in that, apply the ideas in the lesson today to your own listening practice, but make sure you're getting more feedback and more support for your OET preparation. Okay, Iona said deluxe package available for 1 year at that price. That is right, Iona. The deluxe package is valid for 1 entire year, which should be more than enough for you to prepare for your exam. Most people don't take up to a year, but you want to make sure that you are preparing right now to pass the exam as soon as possible. Okay, guys. So anyway, as I was saying, thanks a lot for coming along today. I really appreciate you coming along and taking part in the class. Oh yeah, I forgot to share that I actually need to tell you about our next live class. We at Swoosh English do a live class every week, and our next live class will be an OET mock speaking practice class, Friday, 2nd of July at 9 a.m. UK time. Basically, guys, subscribe to our YouTube channel, follow us on Facebook at Swoosh English, and you'll get notifications about when our next class is. The short answer is we do a class every Friday with official OET and on the Swoosh English page at 9 a.m. UK time. And the next class will be our mock speaking practice class, where I'll go through some mock role plays with lucky students together next Friday. So like the page, like this session today, and subscribe on YouTube to get access to that class next week. Once again, guys, thanks a lot for coming. If you enjoyed the class today, give me a like on Facebook, give me a like on YouTube, subscribe to the channel on YouTube, follow us on Facebook. And once again, thanks a lot for coming along today. Hope that you enjoyed, and I will see you all next week for an OET mock speaking practice class. Thanks a lot for joining, everyone. See you all again. Take care and have a good day. Goodbye.